Assalamu alaikum. Hope you guys are doing well. Wanted to share, unfortunately, some sad news that we had last week. Two of our clients, they had babies that passed away. One was a miscarriage. It was a client who was older, and it was I think it was her first pregnancy, and she was super excited about it. But unfortunately, she had a miscarriage. And another one of our clients, unfortunately, she gave birth, and 2 days later, her baby returned to Allah. We ask that you please keep them in your du'as and ask Allah to give them strength and afiyah to get through this difficult situation. Unfortunately, in Niger, the healthcare situation isn't the best. The maternal mortality rate is about 441. So 441 mothers die during pregnancy or during childbirth out of 100,000 live births. In comparison, in the US, the maternal mortality rate is 22 mothers per 100,000 live births. And then for the infant mortality rate, it's about 63 in Niger. So 63 infants die within their first year out of 1,000 live births. And in the US, as comparison, it's 5. 5 infants die within the first year out of 1,000 live births. So you can see the staggering difference there. And like I said, unfortunately, a lot of these are preventable because it's due to lack of access to good health care. That could be from not having the transportation because they live in rural areas and they're too far. They can't afford to go there, or they simply can't afford to pay for a doctor's visit. And when most of our women, especially that we're working with, are living under the poverty line, they're striving through their businesses to try to increase their profits and be able to save money for situations like these. But in the beginning, it's very tough because they need to choose between, am I going to feed my family today or buy medicine to give to my sick baby? That's a difficult choice that none of us should be able to make. Money is a factor between life and death almost. It's really sad, especially when, from the US where I am, $50 is like nothing for us, right? But that could be life and death for somebody in Niger, where $50 is a lot of money. But unfortunately, that money, which could be used to save a life, people don't have it. And that's why our work at Duha is so important, because we want to be able to give women that financial independence, that stability, right? To be able to not only provide for their families the basic needs, food, water, shelter, but also it enables them to access healthcare. It gives them that financial stability, that independence to be able to afford that transportation that they need to go to the hospital, to be able to go see a doctor when they need to, not to pick and choose between other needs and this need. These very essential basic needs. So we continue to do the best that we can with what we have and try to make an impact as much as we are able to. Keep our clients in your du'as as well. And if you're wondering how you can support us, how you can support our work, our women, the best way is to set up recurring donation with us. We have recurring donation feature on our website. You can go to dohaglobal.org/empower and you can set up a monthly donation, and any amount goes a long way. It can be $10 a month, $20 a month. It all adds up. Thank you. Jazakallah khair. Assalamu alaikum wa rahmatullahi wa barakatuh.